Here at the meeting we're talking about an update to the ELIANA trial, which was a registration trial for CAR-T. It was the first global trial and the first registration trial in CAR-T, and it was for kids and young adults with ALL, relapsed refractory ALL. And I think there are two findings, and one is about MRD that I think is particularly interesting. But the overall findings are we're updating the data set. We have a year longer follow-up in these patients, and we're seeing that of the patients that go into remission, which is 82% of the patients treated go into remission, that 2/3 of those patients remain in remission at 12 and 18 months after their treatment. And most of those patients didn't receive any other further therapy, such as stem cell transplant. So that's the fundamental clinical finding. Now, when we were doing the study, we were doing MRD, minimal residual disease testing, using the US standard, which is multi-parameter flow, and all but one of those patients that went into remission was MRD negative. And so that wasn't really a very good discriminator for us in terms of how patients did in the future, because we didn't have an MRD test that we could separate them by. Now we've sent these same samples for MRD testing using next generation sequencing, high throughput sequencing, using the adaptive Immuno-Seq test. And here we see a really striking difference. So there is a group of patients who are MRD positive by that more sensitive DNA technique. Those patients have a pretty poor outcome with around 30% duration of response. And then the group that is MRD negative by that more sensitive technique, 80% of those patients remain in remission. So that test really does, in this limited retrospective look, seems to be very good discrimination between the ability to stay in long-term remission or not. And those patients who are positive, we may have to think about those may be a group of patients that's more appropriate for transplant.